Hello Manjinder, how are you?
Hi, I'm good. How are you?
I'm good, thank you for asking. So, welcome to Toronto Western Hospital. First
Thank
of
you.
all, let me introduce myself. I am Chanprit Kaur. I am the senior head at the HR department in this hospital. Since you have applied for the position of RN in neurosurgery department, so I'm going to take your interview.
Yeah.
So, are you ready?
Yes, I'm ready.
Okay, so first of all, let me know about yourself, like
Uh,
in
my
brief.
my full name is Manjinder Kaur, and I belong to the India. In my back home, I already did Bachelor of Nursing, and along with that, I have 1 year of experience in the Nova Neuro Hospital. Then I planned to come to the Canada, and I already completed my graduation here, and now I planned to do job here.
Okay. So, first of all, tell me why did you select this hospital for your job?
Actually, there are three reasons
Mm-hmm.
behind the selection of this hospital. The first and foremost reason is my experience, because I already have 1 year of experience in the back home in Nova Neuro Hospital. And the second reason is my interest, because I'm keen interested to treat the patient who are suffering from dementia, Alzheimer disease, and other neurological disorder. And the third reason is the location of the hospital, because hospital is near to my residential area, so I have planned to do job here.
Okay, good. So, since you know in Canada there are many older people who suffer from dementia.
Yeah.
So, what special interventions you can plan for those patients who are suffering from later stages of dementia?
As being a nurse, it's my duty to plan best intervention for the dementia. As we all know, in the later stage of the dementia, the symptom becomes so worst. So my first intervention will be to reorient the mind of the patient, keep the patient's mind busy, keep them engaged in some kind of activity. Moreover, I can also assist the patient in the activities of daily living or the instrumental activities of daily living. Furthermore, I can also prevent the patient from the risk of fall and injuries.
Okay. Since you told me that you have worked as a nurse in your home country
Yes.
in neuro hospital, you must have come across few situations where there is a fall.
Yes.
So, how can you minimize the risk of fall in these units?
Mostly the patients in the neuro units are having some subconscious memories, or they have greater risk of fall. So as being a nurse, it's my duty to reduce the risk of fall and injuries. The first priority is to usage of bed rails, like the side rails, and the other one is you always keep the floors clean, keep them free from any kind of hazardous material. And the next one is you can I will encourage my patient to do go for the regular eye checkup and hearing checkup. And next, I can also teach my patient to go for the strength building exercise and keep them physically active. So these are the some intervention I can plan to prevent the chances of fall.
Okay. So my next question is, as you know, working in a surgery department, there may be few situations where we can manhandle the procedures or it can create risk of infection in the patients. So which aseptic techniques do you think are mandatory inside working the neurosurgery unit?
According to my opinion, there are the two major techniques which a nurse can use. The first is hand washing, and the other one is use of personal protective equipment. These are the main intervention the nurse can use to prevent the chances of cross infection from one person to the another. So these are the aseptic technique which must be mandatory in every hospital setting.
Okay, I really like your knowledge about the neurosurgery unit, but now I wanted to ask something besides the neurosurgery department. Have you ever experienced any type of workplace conflict and how did you solve that?
Yes, I have one workplace conflict. The conflict was related to the conflict of interest, uh, confidentiality versus beneficence. Actually, I had one patient who was my uncle admitted in the hospital, and my uncle said not to disclose my health condition with your aunt. But my one day my aunt came to me and asked about the condition, so I was in the ethical dilemma. I had to choose one condition, either my nurse responsibility to share the information with the relative, and other one is to maintain the confidentiality of the patient. So at that time I was in the conflict of interest.
Okay, since you talked about ethical dilemma, my last question is, describe a time when you cared for a patient with values, beliefs, or morals that conflicted with your own. So, how did that situation affect your relationship with the patient, and how does having a diverse workforce benefit the hospital?
Actually, I have number of patient. I want to share my experience. When I was working in the Nova Neuro Hospital about an year ago, I had one patient who was suffering from the later stage of dementia. Actually, the patient was belonged to the Buddhism religion, and patient was not ready to take the non-vegetarian food according to the religion. But the doctor and the dietitian prescribed him to take the non-vegetarian raw meat and fish. I was in the dilemma, like what to do. I faced autonomy versus beneficence condition. Then I thought, and I respect patient's autonomy, respect the patient's dignity, religious values and beliefs. Then I follow the principle of integrity, and then I openly communicate with the whole healthcare team. And finally, we made an ethical decision, and we respect the patient decision, respect the patient's autonomy, and then we planned to feed the patient only with the vegetarian protein rich diet rather than taking the non-vegetarian food. So this is the time when I respect patient values, autonomy and beliefs. And after that, me and my patient had a therapeutic relation, and we all were very happy after this condition.
So, how does working in a diverse workforce benefit the hospital or any organization?
According to my opinion, working in a diverse workforce has the huge benefits. The first advantage that the healthcare worker get a chance to explore their own culture with the others, and they also learn the other beliefs, values of the other culture. So this is a way that they can easily provide the care to the every patient belongs to any religion or culture if they know their beliefs, values and norms. Moreover, the healthcare worker also get chance to bring new innovation ideas if they work with the expertise who have great experience and knowledge. Moreover, they can also learn the moral values, communication skills and the other soft skill. So working with a diverse workforce is beneficial for the healthcare workers.
Okay, thank you so much, Manjinder. It was lovely talking to you, and we will let you know about the results of the interview. Thank you and have a good day.
Thank you, miss.